Welcome to week 2 of our Prostate Cancer Awareness Month. Today, we will discuss the staging of prostate cancer and the various risk stratification tools that guide treatment decisions. Today's learning objectives are: Introduction to common risk stratification tools for prostate cancer. Understanding how each tool is interpreted and used for treatment decisions. Comprehending the factors that influence treatment choices when evaluating favorable intermediate and unfavorable intermediate risk levels, like risk factors, disease volume, and patient expectations. Apart from the risk stratification scale that uses PSA, Gleason score, and biopsy as baseline data points, there are imaging risk stratification tools that interpret the results of multiparametric T2 MRI imaging studies. We will delve deeper into this topic next Wednesday. There's a myriad of risk stratification tools for prostate cancer. These tools have been developed by organizations like the NCCN, institutions like MSK and UCSF, or through partnerships between the industry clinicians and societies, like the PRIMUS scale used with ExactVu. Today we'll explore the criteria and treatment decision-making process for Gleason with staging. Grade groups. Diamigo scale. NCCN risk scale. The Gleason scale, as we discussed last week, is universally accepted for risk stratifying prostate cancer. Pathologists assign one Gleason grade to the most predominant pattern in the biopsy and a second Gleason grade to the second most predominant pattern. For instance, 3+4. These two grades are then added to form the Gleason score. Although the theoretical range of Gleason scores is 2 to 10, scores 2 to 5 are rarely used since Dr. Gleason's original classification, and typically range from 6 to 10, with 6 representing the lowest grade cancer. The TNM system for prostate cancer considers 4 key pieces of information: extent of the primary tumor, T category, whether the cancer has spread to nearby lymph nodes, N category, whether the cancer has metastasized to other body parts, M category, and PSA score. The primary stages of prostate cancer range from 1 to 4. Some stages are further divided, A, B, etc. Generally, a lower number signifies less spread. A higher number, like stage 4, means more extensive spread. Cancers with similar stages often have a comparable outlook and are treated similarly. A tumor categorized as T1 possesses the following characteristics: not palpable or visible clinically. T1A incidental finding during TURP less than 5% resected. T1B incidental finding during TURP, more than 5% resected. T1C identified on needle biopsy due to elevated PSA. Stage T2 tumors are the tumor palpable on DRE. Additional information indicates the invasiveness of the cancer. T2A, half lobe or less. T2B, more than half of one lobe, not both sides. T2C, tumor located in both lobes. Stage T3 tumors occur when the tumor spread past the capsule into apex, base or seminal vesicles. T3A are defined as unilateral extracapsular. T3B find the tumor bilateral and extracapsular. T3C, tumor found in seminal vesicles. T4 disease occurs when the tumor invades past the prostate, not including seminal vesicles. T4A, spread to bladder, neck, rectum or external sphincter. T4B, spread to pelvic floor and or sidewall. The classification system is one of the most widely used approaches for assessing prostate cancer risk, specific to reoccurrence. Originally developed in 1998 by Anthony D'Amico, MD, PhD, a professor of radiation oncology at Harvard Medical School, this classification system is designed to evaluate the risk of recurrence following localized treatment of prostate cancer. The system categorizes patients into 3 risk-based recurrence groups: low, intermediate, and high risk, using such measures as blood PSA levels, Gleason grades, and tumor stages via T-scores. 1. Low-risk group has a PSA less than 10, Gleason 6, and less than stage T2A. Intermediate risk is defined as a PSA between 10 and 20, Gleason 7, and stage 2B. The high-risk group has a PSA greater than 20, Gleason 8 or higher, and at least stage T2C. Gleason scores, group grades, staging, and position on the D'Amico scale are excellent tools to stratify the aggressiveness of prostate cancer, but there is a significant limitation when evaluating intermediate disease. A Gleason 7, 3+4 possesses much less risk for metastases or reoccurrence than a Gleason 7, 4+3. Failure to differentiate can lead to overtreatment of patients with more indolent disease and undertreatment of aggressive tumors. The National Comprehensive Cancer Network subdivide men with intermediate risk prostate cancer into favorable and unfavorable subgroups. Very low risk disease is small, not felt on exam, can only be found in a small area of the prostate, and have not grown outside the prostate. They have a grade group of 1, Gleason score of 6 or less, and low PSA levels, less than 10. They usually grow very slowly and are unlikely to ever cause any symptoms or other health problems. Low-risk diseases defined as prostate cancers in this group have not yet grown outside of the prostate, have a grade group of 1, Gleason score of 6 or less, and low PSA levels, less than 10, but are slightly larger, CT1 to CT2A, than very low-risk cancers. Intermediate group of prostate cancers can be felt on exam or can be seen on an imaging test. The cancer might be found in more than half of one side of the prostate, CT2B, or in both sides of the prostate, CT2C, and or have a grade group of 2 or 3, Gleason score of 7, and or a PSA level between 10 and 20 nanograms/ml. Additional classifications split the intermediate risk group into favorable and unfavorable categories. Favorable intermediate has all of the following characteristics. 1. Increased risk factor. Grade group 1 or 2. Less than 50% of core positive. Unfavorable intermediate cases have one of more of the following. 2 of more increased risk factors. Grade group 3. 50% of greater of the cores come back positive. High-risk prostate cancers have grown outside the prostate KIA, or have a grade group of 4 or 5. Gleason score 8 to 10, or have a PSA level of more than 20. Very high-risk cancers have a very high risk for the tumor growing, coming back, or spreading to the nearby lymph nodes. They have one or more of the following traits. The tumor has spread to the seminal vesicles, TEB, or into other tissues next to the prostate, CT4. The biopsy tissue shows areas with a Gleason 5 pattern, Gleason score 9 or 10 or grade group 5.
The NCCN guidelines will be the standard we will use when categorizing the risk level of prostate cancer.